Well, as you know, healthcare reform taking center stage in Northeast Ohio today as the president made his final pitch to Congress.
Yeah, the topic seems to have polarized the country. Joining us now to break it all down from the political front is Hiram College political science professor Jason Johnson. And on the medical front, University Hospital's cardiologist Dr. Ari Blitz. And I'll throw it out to both of you. Did he accomplish his goal with his meeting today?
We'll know on Friday if he's accomplished his goal when the votes actually come in. John Bocheri, who's one of our local Congress people, didn't actually attend the event. I mean, there are still Congress people out there that are concerned about linking themselves to Obama's health care plan. So we won't really know if he's accomplished his goal until he gets those 216 votes.
Linking themselves in an election year.
Exactly.
Okay, Doctor?
And I agree with Dr. Johnson. I think that a lot of this stuff is going on behind closed doors. A lot of arm twisting is going on right now that we're not aware of. And I think when push comes to shove, I think it stands a very good chance, unfortunately, of passing.
Why do you see it that way? You are not, which to some might be surprising from a medical standpoint.
I think it's trying to accomplish too much in one bill that is not fully understood by not only the public, but also the people that are voting for and against the bill. It's too much to comprehend. There are too many facets to it that are being linked to the bill that are going to have unintended consequences. And I would argue that it's not going to lead to any cost containment at all.
But if there's this many pieces to it, we've been debating it for a year, how much longer would you have to debate it before you felt comfortable the medical community was satisfied?
I don't think that we need to put this together in an omnibus bill. This should be separated out, the issues clearly defined so that the public knows what is being voted for and can hold their representatives accountable.
Do you agree, Jason?
I think that there are parts of the bill that are extremely problematic, and price control is the biggest issue. Barack Obama promised two things. He said, look, we're going to improve coverage for people, and we're going to control costs. This will increase coverage. Almost everyone's going to end up being covered unless you're hiding in a tree somewhere. But the fact of the matter is, it's not going to do much about costs, and that's what's really bankrupting the country. That's what's hurting our economy. I haven't seen anything that convinces me that that problem has been solved, even if they're going to allow these sort of medical buying groups and buying across states. But again, he is banking the last year of his entire term on this, and he's hoping he can push it through and fix the problems later.
But is it really a win if he pushes through something that has changed so dramatically from what he started?
It's better to look like an incompetent bully than look like an ineffective bully. If you push through something that people don't like, but you're successful at pushing it through, they will forget that they don't like it. They'll be impressed at the show of strength. And if there's one thing Obama wants to show, it's that he can muscle his own party into accomplishing his policy initiatives.
Dr. Blitz, real quick, final thoughts.
Well, I think that Dr. Johnson touched on a very important point. This is a matter of democratic hubris. It is a matter of pride now, pushing something through that most people do not want.
All right, both of you, doctors, thank you so much for joining us and giving us your perspective. Coming up, he claims his Toyota self-accelerated to speeds of 90 miles an hour. But tonight, there's reason to wonder if the story of the runaway Prius actually happened.